What is the most important thing you should work on when working on stress management? Hi, my name is Dr. Mike Nowazek, and I'm a naturopathic doctor at Green Apple Healthcare in Edmonton. And in this video, I'm going to go over what I think is the most important thing that you should be working on when working on stress management. Stress, how it affects the immune system, that was covered in my previous video. In this video, what's the most important thing? Let's get to it. Sleep. Improving sleep is what I consider the most important thing to work on when working on stress management. Poor quality or lack of sleep itself can suppress and weaken your immune system, let alone the effects that stress itself has on your immune system. So working on your sleep and improving sleep can significantly improve your stress management and therefore positively affect your immune system. Now, how much sleep should someone get? It should be anywhere between 6 to 8 hours. Those are the recommendations normally heard from health officials, and I would agree with that. For the most part, I'm trying to lean more towards 8 hours with my patients, and a good solid 8 hours all the way through. You don't want it broken up. You don't want to be getting up through the night all the time. You want to try and get sleep at least 6, preferably 8 hours through the night. Some people need more. Some people need less. Understand, if you end up having less, it's going to negatively affect your stress and therefore negatively affect your immune system. And so you want a quality sleep, you want a decent amount of sleep time. Now, there's two types of insomnia. There's two types of difficulties with sleep. The first type is difficulty with getting to sleep. The second type is difficulty staying asleep. So let me discuss difficulty with getting to sleep first. Usually that has to do with what we call sleep hygiene items. So what are you doing before bed that is interfering with your ability to get to sleep? Often that has to do with having your mind too ramped up due to electronics, being online too much, watching TV. So normally we recommend that our patients stop their electronics, turn off their electronics, turn off the TV at least an hour before bed. Then what you want to do ideally is read before going to bed. And what you want to read is something like an adventure or a comedy, something simple to read, nothing too difficult, nothing too complex, and certainly nothing related to what we're going through right now with our current stressors. I'm also recommending to a lot of my patients right now that they actually stop watching TV and get off of their electronics by noon in the day. I'm finding that 1 hour before bed just isn't enough for some reason. The stress is really high, and I highly suspect that's the reason. There's a huge amount of stress, and everybody's worrying about many different things. Watching the TV too long and staying online too long is certainly not helping. And so turning off the electronics and turning off the TV by noon, stay updated, that's important, but turn everything off by noon and then do other things through the day. And I'm going to get through some other videos on what we are suggesting to our patients that they can do through the day to decrease their stress and get their mind off of their stress. But right now we're telling people, get off your stress and your electronics and the TV and all of that kind of stuff by about noon and spend the rest of your day doing quality activities. The other thing to do is to be careful with what you watch on TV. Anything that's going to be too stimulating or ramping your brain up is going to put you into an excited, stressed mode. And that's going to make it extremely difficult to sleep, especially if what you're watching is overly violent. Certainly try to stay away from the apocalyptic style movies and TV. Those are just not a great idea to be watching right now, given what we're going through with the viral stuff going on in the world. And so be careful with what you're watching on TV. We are recommending to watch something simple, something light. Comedy is a really good idea, and adventure is a really good idea. The more you laugh, the better. And laughter as medicine, I'm going to do another video on that in a few in this series on how laughter can not only improve your immune system, but just really calm down the stress and the effects that stress is having on your body. And so the main thing about getting to sleep and improving your ability to get to sleep is turning off the electronics and the TV and getting your head out of that space and start to calm down your mind, not have it so stimulated and ramped up before sleep. It's a good idea to read. It's a good idea to read action, adventure, or comedy. Nothing too stressful, nothing too stimulating. Certainly stop watching the news too late at night. It's going to get you thinking too much about the stressors. The next thing about sleep is staying asleep, and that's considerably more difficult to work on than trying to get to sleep. Trying to get to sleep classically is more to do with sleep hygiene stuff. It's not always 100% true. Obviously, there are other things that can affect your ability to get to sleep, but usually the simple things that you can do can really help your ability to get to sleep. Staying asleep is a lot more difficult, and so with staying asleep, it usually has to do with an inability to stay asleep. It usually has to do with, again, stress and what you're watching before you go to bed, but it also has to do with eating habits, hydration levels, salt intake, those types of things. And so you got to watch what you're doing before you go to bed, how much you're eating, what you're eating, the salt intake, that kind of stuff. That will affect your ability to stay asleep. What we do recommend to some patients, if you're having a difficult time staying asleep, is get up, have a glass of water, think about an adventure. Try to get your mind out of your stress, because people who wake up during the night and have a difficult time getting back to sleep, it's because their mind is racing. Their mind is thinking nonstop about something, and usually it's the stress that they're worrying about. Getting your mind off of that isn't the easiest thing to do, and so reading a book, an adventure book, is a good idea. Trying to put your mind into a personal adventure. And imagine yourself skiing. Imagine yourself doing your favorite hobby. Imagine yourself going for a hike. Imagine yourself enjoying certain things in life that you really love to enjoy. If you can get your mind off of your stress and focus on getting your mind into an adventurous sort of role, keeping your mind active with doing something other than your stress, it's going to be a lot easier to get back to sleep. There are many different supplements, vitamins, and herbs that can be used to help sleep. Some of them are used to help you get to sleep. Some of them are used to help stay asleep. Obviously, I can't go over them all in a forum like this. It's too complicated. There's too many to possibly go over, and everybody is individual. You can't just recommend a whole bunch of different things. They may react well with one person, but not well with another person. I can't take into account people's health, their medications, those types of things. So there are different herbs and supplements that are available. If someone's interested in doing that, you can get a hold of our office. Even though our office is closed, we're still available to see our patients online and virtually, and so you can give us a call and talk to us about those types of things. I hope you found this video informative. If you have any questions, give us a call. Thank you.